did you know the number of moles someone has is directly associated with their skin cancer risk, especially melanoma risk? And so the secret number, or the magic number, is 100. If you look like, oh, I might have more than 100 moles, your melanoma risk is actually higher. And so I would actually highly encourage you, if you've got more than 100 moles, you probably want to come in for a check. We may even want to consider doing the mole mapping so we can keep an accurate eye on all those moles over time. You know, in Australia, we hear a lot about melanoma. Why is that? Well, did you know that Australia is actually, well, not just Australia, Queensland in particular, is the melanoma capital of the world. Now, if you're a Melburnian like me and you live in Victoria, we actually we're not lagging too far behind the Queenslanders. So I'd be saying that, you know, this is why that if you're living in Australia, if you've grown up in Australia, if you get any sunlight at all in Australia, more than just as a tourist, I'd highly encourage you, get your skin checked. Because the sun exposure and the amount of damage the sun can do in Australia, for whatever reason, is different compared to overseas. We don't know all the intricacies as to why that is the case, but we certainly do know that that being in Australia increases the risk of someone having melanoma. Some other interesting facts is that not everyone picks up melanoma at the same rate. So for instance, people who have pale skin, like my Aussie friends, they're going to be much more likely to get melanomas. Asians too, but if I have some darker skinned friends, like for instance, I've got some Arab friends or Indian friends, they're less likely to get it. And if I have an African friend who is from the Sudanese and is really dark, he's the least likely to get melanoma. Now, that's not to say that they don't get melanoma, but it is the darker the skin, it is protective against melanoma. Other things to be mindful of is that melanoma is actually not just sunlight driven. And this is really important. Sometimes when you come in for the skin check, people have asked me, why are you checking there? And also, we often will put a throwaway line. When you come in for a skin check, we usually get you to undress down to your underwear, or if you're a lady, your bra and underwear. And we say, we don't check within your bra or underwear area, but if you've got a mole you're concerned about, please let us know. And you might be thinking to yourself, well, that's really odd. I'm usually in my bikinis or in my bathers. I don't get any sunlight over there. Why would I get a skin cancer there? Well, really important is to know that melanoma is not just related to sunlight exposure. People actually can get melanomas in all sorts of weird places, like the soles of the foot, in the retina, and there's one famous case that was around the anus, which is really unfortunate because that wasn't picked up until it spread. So melanoma, there is a genetic component, and so therefore it can actually happen in non-sun-bearing skin areas. So it's really important to be mindful of that. You'll also often hear us asking when you first come in, is there any family history of skin cancer? Well, for melanoma, that is particularly pertinent because if there is a first-degree relative or any sort of multiple family members with melanoma, then that individual's risk of melanoma rises dramatically. So it's really important that you ask your family and your friends, family and relatives rather, that if someone has had a skin cancer cut out, you want to be checking what type of skin cancer was it cut out. If it was just the basal cells and squamous cell carcinomas, that's all fine. But if it's a melanoma, your ears should be pricked and you probably should be booking in to see a skin cancer doctor just to get everything checked out. An interesting fact as well is that, again, just to emphasize the fact that melanoma is complex. And this interesting fact is that, did you know melanoma survival, so I'm not talking about incidence of melanoma, but melanoma survival is associated with those who have had greater sunlight. In other words, even though we know that those who have had greater sunlight are more likely to get a melanoma, the fact that they had greater sunlight at all actually is associated with improved survival. Now, why is that the case? Well, that's actually still up for debate in the scientific community, but I'd actually direct you to my Lifestyle of Medicine talk on light and light health benefits and light therapy, because I think that might actually hint at why some people live longer or survive better with the melanoma diagnosis with greater sunlight exposure. Anyhow, it's something that the scientific community is still researching, so stay tuned on this topic.